Students, continuing on our study on diabetes and long-term complications, and on our second discussion on diabetic foot care, we're going to talk about ways to avoid serious problems with the foot. Remember, we mentioned earlier that there are two components, neuropathy and a lack of circulation to the foot, that can cause the problems. Now, how do we keep our foot safe? Let's look at some things. First, what do we not do? What do we not do? First, the diabetic should not try on their own to remove corns, calluses by themselves. Not a good idea. A podiatrist would be the good person to handle that. What about hot water bottles? What about heat? Well, the diabetic, for their feet, well, they should always avoid hot water bottles, electric blankets, and heating pads. How come? They don't always sense, they sometimes don't feel the danger that's there. Remember, they don't feel the pain, they don't feel the heat that puts them at risk. What about soaking the feet in hot water? Oh no. Take a look over here, folks. What does it say? There's the water. Do not soak foot in hot water. What about walking on hot surfaces and sidewalks and the beach? Should be avoided. Be careful about using mended socks. In fact, do not use them. Did you know that when a sock is got just a tiny, even a rip in it, it can cause an irritation that can cause a foot ulcer. Wear shoes. Never wear shoes without stockings. Always have socks with your shoes. What about lotion? We're going to talk about lotion, but for right now, on the don'ts list, do not put lotion between your toes. Do not put lotion between your toes. You're going to find out that the between the toes areas is something we need to be very cautious with. Let's go over some do's. First of all, do check your feet every day. Check your feet every day. The diabetic must check their feet every day. Check for redness, blisters, swelling. In fact, here we have a picture. Check every day. You might consider, or it's advised to use a mirror when you check every day. All right. Wash feet every day. Wash feet every day and thoroughly dry when you're done. It's recommended that you pad dry the feet. And an important point, especially between the toes, you need to keep dry. What about trimming the nails? It's a good idea to trim the nails, but remember we do it straight across. Let's talk a little about shoes. First of all, you've got to have a good pair of shoes. Here's a shoe. There's a foot that will fit into the shoe. Remember the old adage, if the shoe fits, wear it. But right here, safe. This foot's big. You don't want to wear that shoe with that foot because it's going to put pressure and cause some problems. Always wear shoes. Be sure no torn linings, rough or sharp points. Okay? Another do, lotion. Is it a good idea to have lotion? Yes, it is. One of the problems with the diabetics is sometimes the foot does not secrete the moisturizing elements that prevents the cracking of the skin. If the skin cracks, infection can occur. So a very good idea to put lotion on the foot. However, never do you put lotion in between the toes. Let's look up here for just a moment. Again, diabetic foot care. When we cut the nails, as we mentioned earlier, they're to be cut straight across. An emery board is a good idea to smooth out the edges so they don't cut. Remember here we said about the lotion. Lotion is a good idea, but do not apply them in between the toes. Keep the area in between the toes dry. Another thing on the nails again, do not round off the nails. That can cause cuts. We mentioned about applying lotion. We also mentioned do not soak the feet in hot water. One good idea for our diabetic is to have their feet examined at least once a year by a physician. Now we want to keep those feet. Remember we said that 80% of the amputations that are done in America, 80% of the non-traumatic amputations are related to diabetes. So this is a source of problem. We want to keep the feet. So we want to encourage diligent care, have them checked by a physician at least once a year, and if there's anything that they notice in their feet, redness, swelling, anything, any cut, anything, they need to talk to their doctor immediately. You got to put our foot down. Thank you very much for listening.